Hi guys, so today I wanted to share something about my personal hair loss journey. Oftentimes when patients come to the clinic, they often ask, have you had a hair transplant done? What medications have you been on? The reason I wanted to make this blog was because I think it takes a lot of patience, a lot of courage to come to our clinic because hair loss is a very sensitive topic. It can affect some individuals' confidence about how they see themselves, how they interact with people socially. So it took me a lot of courage to do this blog, to be honest with you, because I think it is a very personal topic and something that I didn't really want to share with the whole world for quite some time. So for myself, I'm 42 years old. I have been experiencing hair loss for around 15 years now, I think. I've optimized myself medically thus far, but over the last year to 18 months, I've realized that the progression of the condition is speeding up a little bit. This is something we talk about during consultations, that there's no fixed regime how this condition is going to evolve. So I've noticed over the last 18 months that I'm getting quite thin around the mid-zone and the crown as well, despite being on oral DHT blockers. One of the main problems that we all have, especially being men, is we want to balance the risks of medication with other systemic side effects. We've often known that with the usual DHT blockers, we're going to systemically block 70% of the dihydrotestosterone or DHT, and around 40% is blocked in the scalp. So what I'm going to be doing over the next 6 months to the next year is I'm going to continue on my oral medications, but instead of increasing the dose or going on to another format of the DHT blocker, I'm actually going to be partaking in a cocktail of different DHT blockers that are injected into my scalp. The rationale here for myself is I want to keep the DHT blockers in the scalp. The risk of systemic overflow is low. It's not nil by any chance, but it's very, very low compared to taking it systemically. And I'm going to be doing this sort of every month and just documenting my progress. I took some pictures on the 3rd of November, a couple of weeks ago, and then I will take pictures every single month. So that's my story. So I'll show you what we're going to do. We'll show you how the procedure's done, and it's just really for educational purposes. I hope that really helps, and thanks very much.